Howdy and welcome to another video edition of Remedyland. Today I want to talk to you about maxillary tuberosity. The maxillary tuberosity is a big, curved space on the outside of the maxillary bones, or perhaps the bone fragments of the upper jaw in the region of the back teeth, the wisdom teeth in the back of the oral cavity. The maxillary tuberosity is tough and also is protected by hard periodontal tissue. Difficulties can take place in this particular area of the oral cavity throughout tooth treatments, for example removal of a tooth. Removal of a tooth is considered the most typical small dental surgery carried out. Side effect of extraction varies from periodontal damage to fractured jaw in the lower jaw, as well as fractured maxillary tuberosity or antral connection in the maxilla. The superior alveolar nerves basically is the nervous system that cause an individual to receive filling in his or her second and also third wisdom teeth, along within the majority of the tooth roots of the primary molar tooth. The maxillary tuberosity is permanent, considering even in case a dental surgeon removes each one of an individual's top teeth, the maxillary tuberosity stays. Removal of the tooth demands that the adjoining alveolar bone be extended to enable an unimpeded path for tooth extraction. Top third molar can be found right in front and within the maxillary tuberosity. The fracture of a big part of bone in the maxillary tuberosity region is a scenario of major concern, which unfortunately can lead to torrential bleeding because of near distance of important blood vessels to the region. Maxillary tuberosity is particularly essential for the stableness of top denture and might result in antral communication in the event that is fractured. Latin words have resulted in the development of the term of the rounded prominence in the upper section of the oral cavity. For example, the phrase tuber in tuberosity is the Latin phrase for bump or swelling. However, maxilla in maxillary is produced from the Latin phrase mala, which translates to mean cheek. The Latin term macerare additionally signifies to bite, which possibly was the base for the phrase maxilla also. A fracture of the maxillary tuberosity is a significant health problem. This kind of fracture needs to be prevented, since this bony projection will help a person's top dentures to stay in location. Additionally, a fracture in that region ultimately can result in maxillary sinusitis and swelling of the maxillary sinuses because of infections, fungi, and also microorganisms moving from the oral cavity into the nasal area. A couple of scenarios create a fracture in the bone behind and above the third wisdom teeth tooth very possibly, and repairing this region frequently includes splinting. A wisdom tooth which is located in the region independently, too much pressure employed to remove the tooth, or perhaps an abnormal quantity of tooth roots on the tooth, just about all is capable to cause a maxillary tuberosity fracture. In the event that a fracture happens, a dental surgeon usually splints the region with arch bars to create the moving parts of the bone steady for 5 to 7 weeks. Following proper healing recovery, a surgical extraction treatment might be tried. Nevertheless, in the event that the tooth is contaminated or perhaps symptomatic during the maxillary tuberosity fracture, the extraction ought to be carried on by loosening the gingival cuff and also eliminating as small bone as reasonably achievable, while trying to stay away from splitting up of the maxillary tuberosity from the periosteum. In the event that an effort to eliminate the joint bone is not successful and the contaminated tooth is presented with the connected maxillary tuberosity, the damaged tissues needs to be shut with waterproof sutures, since at this time there most likely are not a medical or antral communication. The dentist could choose to graft the region after 4 to 6 weeks of recovery and also post-operative antibiotic treatment. In the event that the tooth is symptomatic, however, there is absolutely no honest signal of purulence or contamination, the dentist could choose to try to make use of the connected bone like an autogenous graft. I hope you've enjoyed this video edition. We'll see you again on another video edition of Remedyland. Take care.